the spike protein resembles many of our own tissues. That's what molecular mimicry is. This is where our immune system can't tell the difference, or let's say it's a case of mistaken identity. It's where it's trying to attack the spike protein. It wants to attack the spike protein. But unfortunately enough, the spike protein is so similar in many ways to our vital tissues here, our cardiovascular structures, our neurological structures, absolutely our mitochondrial structures, that what ends up happening is our immune system attacks the wrong target because they look similar. And so this is one of the mechanisms of autoimmunity. And so not only are these patients, if they're vaccinated, producing their own toxins, they're generating their own spike protein, but on top of that, their immune system is destroying their own tissues. They're being destroyed from within by their own immune system. We've seen so many different cases here, from many cases of turbo cancer, a lot of neurological deficits, mild cognitive impairment, early onset dementia, these types of things. And when you start to pull the string and you start to say, okay, what's actually happening? What's the cause behind the cause, so to speak? And again, this is a large statement too, but we're able to identify large amounts of spike protein in every one of these cases. It's a 1-for-1. Now, in addition to that, before we turn the slide, we have to mention, at least two more things here. We see a tremendous amount of infertility in my practice, and there's a lot of reasons for that, of course. It's not all spike protein, but as I said at the outset here, sure, you need to screen them for toxicity. Absolutely look for parasites. Absolutely screen them for the whole world of Lyme disease nowadays. That's something too that'll really blow you away. If you're not testing for these or you're not skilled in that arena, I would highly recommend it, because you're going to see, you're going to see this combo quite frequently, where they're suffering from long COVID and some derivation of Lyme disease or a co-infection of Lyme disease, which is its own conversation. But absolutely, I have seen the husband get vaccinated and the wife will come in with, vaginal bleeding, or her cycle is just completely thrown off. She gets rashes. She's exhausted. I mean, she's the one that's suffering the consequence of him getting injected right away. It's unbelievable, and the severity of the cancers, the aggressive nature of the cancers, and of course the speed of the cancer, how quickly it is to transition to the vital organs. And of course, if you don't have an answer for that, I mean, I don't care how good your intravenous vitamin C is or how good your chemotherapy is, if you don't have an answer for the spike protein, unfortunately, you're very highly likely to lose these patients, because that's actually what we found that's driving it. And that's actually what the literature, and Dr. Tina is going to do a couple slides on that and talk about what the actual literature says on the role of spike protein and what it's going to do in that arena in terms of tumor suppressor genes. And, and it does have its own very specific mechanism there. And this is separate from what we know about cancer nowadays as a mitochondrial disease or a metabolic disease. CO2 is absolutely critical for the red blood cell to give up its O2, the oxygen. And so we get this CO2 deficiency in these cells, where they can't do that swap in the periphery of the body, right? The cell-to-cell swap between the red blood cell and the tissue cell. And the cell loses its ability at that point to draw in oxygen from the hemoglobin. And of course, that's it. The cell's had it. It's now got to rely on glycolysis, right? Or as we say, anaerobic or fermentation. And of course, that's a cell on its way to diabetes and guaranteed neoplasia, right? That's a cancer cell. So, there's multiple mechanisms at play here as to why these cancers are so very aggressive. And, another one, how about as we mentioned earlier, the immune system being absolutely crippled. The CD4, our helper, is absolutely, vital to mount a proper immune response against your cancer cells. Your T cell response is the name of the game. I mean, how do you beat cancer in an integrative sense? You strengthen the T cell response and you flood the tissues with oxygen. Well, to that, I would add, you remove the spike protein nowadays. Of course, one of the main superheroes that you need to know about is augmented NAC. Nothing's going to do what it does.
We actually have 3 very protective genes that are constantly looking out for cells that become cancerous and then sorting them out. And we are making cancer cells the whole time. But these genes, their job is to check constantly, and when they see that there is a cancer cell developing, to destroy it, or to take some of the organelles out that are healthy and fine and recycle those and get rid of the rest. And this is the PRB gene, the BRCA1 and the P53 gene in particular. And the spike protein actually somehow stops them from doing their job, and it actually prevents their gene expression. And then we have 17 cancer-causing genes, these oncogenes, which promote cancer, which are normally kept fairly dormant in our bodies, but this is promoted by the spike protein. These genes are turned on, and as a result, we have seen many more cases of brain tumors, breast cancers, colon cancers, melanomas, lymphomas, leukemias, etc. And that is that, yes, because our normal defense mechanism is completely shot to pieces. Next slide. And this, again, if we can get rid of the culprit, the spike protein that is causing these genes to malfunction and to be stimulated, then we can actually restore, get rid of the spike protein and then restore the function of these genes so that the body can get back into balance, into homeostasis.
Most pressing issue, and the first goal of care, I would say, should be using augmented NAC. It works tremendously well at destroying spike protein, which is your first goal of care. That's what's damaging them right away more than anything is the exposure to excessive spike toxicity. As Dr. Tina said very eloquently, this is the most toxic protein ever known to the human species. We're not built for this. Okay, our immune systems don't really know how to handle it. SNAC is incredible as a molecule, and it really beefs up those protocols for neurological health. Chronic infections, 100%. You have antiviral properties, and it's really, you're not going to go wrong. I mean, I don't think there's anybody who's not going to benefit from NAC supplementation, and that would include augmented NAC. The big difference being augmented NAC is also going to have that 10x, that tenfold spike protein efficacy, which you're not going to get with traditional NAC. I recommend augmented NAC for all of those conditions. I mean, if you want to look on Google, for New Era Medical, pull our Google reviews up, you'll find dozens of 5-star reviews and very honest reviews about these people, how badly these people were suffering, and what we were able to do for them. Now, yes, I have a 5,000 square foot facility. I've got 22 medical staff. I mean, we have a relatively large center here, and we do a lot. Is the point? I'm not going to say everything is augmented NAC, but I did mention early at the outset, how do you know the person has spike toxicity? They're on planet Earth is the answer. So you're not going to go wrong if you actually do apply that and you do start giving everyone augmented NAC. You'd be doing them a huge favor.